A person's blood pressure is always determined by the condition of the muscular layer of the vascular wall. Our cardiovascular system consists of the heart, the little motor that pumps blood, and the blood vessels through which blood moves via the arteries to the target organs. There are veins through which blood returns, and the capillary where the artery transitions into the vein. Now look, our vascular system contains a certain amount of blood. A person's blood volume is, let's say, about 5% of their body weight. So if your body weight is 100 kilograms, you have 5 liters of blood. Although this amount, let's say, can fluctuate. That is, a certain portion of interstitial fluid can enter the vascular bed or conversely leave the vessels and move into the tissues. Therefore, this is also quite a dynamic indicator. And this blood is inside the vessels under a certain pressure, but this pressure is created by the muscular layer of the vessel wall. The muscular layer can go into spasm, and then the blood pressure in the vessels increases. The muscular layer can be relaxed, and in that case, arterial pressure decreases, drops. And essentially, the tone of the muscular wall determines the pressure in the arteries. But sometimes, friends, certain events occur in the body, events that lead to a sharp increase in a person's blood pressure. A sudden, significant rise in blood pressure accompanied by damage to target organs such as the brain, heart, kidneys, eyes, and peripheral parts of the body with impaired blood supply to these peripheral areas is called a hypertensive crisis. A hypertensive crisis is when blood pressure rises suddenly, rises sharply, and is accompanied by catastrophic conditions and changes in the internal organs. Why does blood pressure increase? Well, first of all, because the person has had high blood pressure for a long time. That is hypertension that is either being treated or poorly treated, usually with medication, and often with the wrong medication as well. And then the person already has a hypertensive background. They already have a tendency toward hypertension, a tendency toward high blood pressure. They don't drink water, their kidneys aren't functioning, and they're damaging their kidneys with medication. This is how the background for a hypertensive crisis is created. Of course, for blood pressure to spike dramatically, there has to be something like, well, stress. Stress, meaning some kind of information. What is stress? It's my body's reaction to receiving some kind of information. You hear something, you see something, some kind of information comes in. A person gets scared. As a result, two things happen: activation of the sympathetic autonomic nervous system and the release of adrenaline by the adrenal glands. Both the first and the second lead to the narrowing, the constriction of blood vessels, specifically the muscular walls of the vessels. And then, naturally, blood pressure rises. The pressure in the vascular system increases. Another factor that can cause a sharp increase in blood pressure is physical exertion. But these exertions are mechanical, physical loads running, sports, or any kind of strain a person puts on their body. And again, this leads to the activation of the same adrenal, sympathoadrenal system. Adrenaline is released, the sympathetic nervous system is activated, the blood vessels constrict, and the blood pressure rises sharply. Guys, why is this bad? Well, understand this correctly, it's very bad, especially if an older person's blood vessels are already weak. Then any sudden increase in blood pressure in this vascular system can lead to a catastrophe. Well, the vessels can burst. The vessels can burst, causing bleeding. It's not so bad if it's just a nosebleed. But what if it's in the brain? In the next videos, we'll go over cerebral hemorrhage and hemorrhagic strokes. What they are, what the consequences can be, and what needs to be done in such cases. But you need to understand that this is a catastrophic condition. And a hypertensive crisis has its own neurological manifestations, meaning symptoms related to the brain. And just like with strokes or transient ischemic attacks, it has two types of manifestations: general cerebral disturbances and focal disturbances. But while transient ischemic attacks are mainly characterized by focal disturbances, here the general cerebral symptoms predominate, such as severe bursting, pressing headaches, disturbances of consciousness, and sudden overall weakness. Any movement of the head causes an even more excruciating headache. Because of hypertension and elevated blood pressure, cerebral edema occurs. That is, a lot of blood flows in, but little fluid leaves through the veins, leading to swelling of the brain. This, in turn, irritates the centers in the medulla oblongata, causing disturbances in heart function, breathing, and the digestive system. That is, in the medulla oblongata, the center responsible for vomiting is activated. As a result, the person experiences nausea, which may end in vomiting, but not of any food they've eaten. Normally, vomiting occurs when someone has been poisoned or has eaten something bad, and they vomit it out. But in this case, the vomiting is of central origin. Without any food intake, this indicates impaired consciousness. When a person begins to experience confusion or even loses consciousness, this is a manifestation of general cerebral dysfunction. And this is a critically severe condition for the human body, requiring emergency medical assistance. These are the manifestations of a hypertensive crisis, specifically its neurological complications. How should it be treated? Many people think that Dr. Golod, even though he's a neurologist, always talks about turmenium mats. Many believe that now, to solve the problems of a hypertensive crisis as well as those of hypertension, Dr. Golod will talk about turmenium ceramics. Guys, no. The thing is, if you want to use turmenium ceramics, you're a little bit late. Turmenium ceramics should have been used to treat hypertension so that your blood pressure would be normal and you'd have good stress resistance. That's right. But when a hypertensive crisis has already occurred and your blood pressure is 200/120, you don't have the luxury of taking your time and achieving slow results. This requires emergency care to save the person's life. And this needs to be done right now. And the first step here is to lower blood pressure. When you use methods to lower blood pressure, well, we act on the kidneys, we prescribe diuretics. But at this point, we're no longer talking about ACE inhibitors or angiotensin receptor antagonists. Here, you need to act decisively, act powerfully. We prescribe diuretics. Diuretics shut down the function, the second stage of urine formation. This is the concentration function. And because of this, the urine that comes out is primary. There's a lot of it. It's light in color, but a lot of fluid leaves the body with the urine. And essentially, because so much fluid is leaving, the amount of blood in the vessels decreases, and blood pressure automatically goes down. As a result, or as an option for lowering blood pressure, of course, we prescribe myotropic antispasmodics, that is, medications that relieve spasms specifically in the muscular walls of our blood vessels. The same magnesium sulfate, the same, yes, clonidine, analog of euphyllin, clonidine, platifillin. In other words, a vasodilator that will relieve vascular spasms, simply causing a mechanical reduction in blood pressure. And in ancient times, how were hypertensive crises treated? In order to prevent an apoplectic stroke, they performed bloodletting. They would simply open a person's blood vessels, let out a certain amount of blood, and as a result of the blood loss, the pressure would decrease and a stroke would not occur. A stroke didn't occur only because they reduced the amount of blood in the person's vessels, and that in turn lowered the blood pressure. So the first thing that needs to be done here by any means and by any mechanisms is to lower blood pressure. Of course, improving the aggregate state of the blood is also important. That's why we prescribe antiplatelet agents, a wide variety of medications that we administer intravenously. We use these drugs to improve the condition of the blood so that even under conditions of hypertension, elevated blood pressure, the blood flow to distant peripheral areas is not disrupted. Of course, also reducing autonomic addressing, autonomic disturbances is important. But what should we understand about the autonomic system? In many cases, a hypertensive crisis is accompanied by activation of the autonomic nervous system. That is, this crisis, a hypertensive crisis, is also accompanied by sympathoadrenal changes. Naturally, they manifest as symptoms in the gastrointestinal tract. They also affect the function and work of the heart. That is, this includes tachycardia when the heart is pounding, feels like it's jumping out of the chest, and very often this is also accompanied by psychological disturbances. In other words, the appearance of a feeling of fear. That's why what used to be called sympathoadrenal crises, or called sympathoadrenal crises, now guys, called panic attacks. Why is that? Because this state of activation of the autonomic sympathetic nervous system is accompanied by psychological disturbances in the form of a fear of death. That's why a person experiences panic, and that's why they're called panic attacks. That's why sedative medications are also used, which help stabilize the mental state, stabilize the functioning of the cardiovascular system, improve heart activity, and generally enhance blood circulation. Naturally, trophic therapy is also used, but the treatment of a hypertensive crisis as well as a transient ischemic attack is essentially a matter of providing resuscitation measures to the person. This is done to preserve, let's say, life itself, to maintain vital signs. This is a resuscitation pacienta person whose treatment must absolutely take place in an intensive care unit, because such a condition can lead to, well, the worst possible outcome. It can cause death. Therefore, in this situation, the main goal is to stabilize the key vital parameters. And addressing neurological problems, focal deficits, which, by the way, are not typical for a hypertensive crisis, becomes secondary and is dealt with later after the stabilization of the body's vital functions. But a hypertensive crisis, unlike strokes, has the same characteristics as a transient ischemic attack. It resolves within a few hours, provided that the treatment is correct and effective. Both a transient ischemic attack and a hypertensive crisis leave no traces when an MRI or CT scan is performed. That is, when examining the brain, there are no focal signs, no signs of stroke, no evidence of changes in brain tissue. This is also an important factor that we use to distinguish between them. It is precisely the presence of a general cerebral syndrome that may indicate either a stroke or a hypertensive crisis. But when we perform an MRI, we do not find any changes in the nervous tissue in cases of hypertensive crisis. However, friends, there are situations when changes in the nervous tissue do occur. And in that case, it is not a transient attack. It is not a hypertensive crisis at that point. It is already a stroke. There are differences there as well. Strokes can be hemorrhagic bleeding in the brain or ischemic. But I think we will talk specifically about strokes in our next video. So stay tuned to the channel Dr. Golod's Health Academy. With me, it will definitely be interesting, and we will discuss this in the upcoming videos. Well, for today, I say goodbye to you, friends, and until we meet again, goodbye.